Today, we are going to review the key differences between veneers versus bonding versus crowns. Which procedure is best for you? Let's find out. Hi everyone, welcome to our channel. In this video, we'll cover three important aspects of these three different treatments. The first will be what they actually do, how they work, and what each procedure entails. Second, we'll review the cost of each treatment option. And third, we'll discuss their longevity and how long they last. At the end of the video, I have a summary of which of these options are best used in certain situations and more suitable to you. So let's get started with veneers. Dental veneers are thin, custom-made shells that are bonded to the front surface of the tooth. They can be made from either porcelain or composite resin. The porcelain has a natural look, is stronger, and is more resistant to stains. Porcelain veneers require a bit more work and typically involve removing about 0.5 millimeter of enamel on the tooth surface, creating an impression, having a model of your mouth made in a lab setting, and then getting the veneer permanently cemented on your tooth. This process usually takes 2 or more visits, and it is considered an irreversible procedure because the enamel is removed and cannot be replaced. Porcelain veneers typically cost between $900 to $2,500 per tooth and generally last between 10 to 15 years. Sometimes they can even last longer than that if good oral hygiene habits are followed and regular dental checkups are performed. Composite veneers, while not as long-lasting, are less expensive and can cost anywhere between $250 to $1,500 per tooth. Dental veneers are ideal for treating teeth that are chipped, gapped, or severe discolored that cannot be proper fixed by whitening treatment. For a major overhaul or significant changes, veneers are typically better. While veneers can improve the appearance of your smile dramatically, they're not without their disadvantages. If you don't have enough tooth structure to support the veneers, additional work like crowns may be necessary. If your teeth are misaligned, veneers may not be the best solution for you. However, if you're looking for a long-term solution to improve the appearance of your smile, veneers may be a great choice. Now, let's talk about dental bonding. Dental bonding is another tooth-colored cosmetic procedure that is often used to improve the appearance of teeth. Unlike veneers, bonding uses a tooth-colored composite resin that is applied directly to the tooth and then hardened with ultraviolet light. The composite resin is sculpted and shaped to blend in with your surrounding teeth. The procedure is much simpler than veneers and does not require any impressions to be taken. It is also very quick and can be completed in just one visit and requires minimal removal of enamel, if any at all. In some cases, only a small amount of tooth structure needs to be removed. That's why it's sometimes called tooth painting. Dental bonding costs between $250 and $1,500 per tooth and generally lasts between 5 to 10 years. Just like veneers, bonding is a conservative and non-invasive procedure that can help to repair minor cosmetic issues like small chips, cracks, gaps, or stains. In fact, bonding is very versatile and can be used in many different ways to improve the appearance of teeth. It can be used as a preventative measure to protect teeth from further damage by strengthening them. Although bonding is less durable than veneers or crowns, it is a more affordable alternative for those seeking to improve the appearance of their smile without spending as much money. Another advantage of bonding is that it is a reversible procedure. This means that if the composite resin should ever wear away or become discolored, it can be removed and replaced with new material. Now, let's move on to dental crowns. A dental crown is a restorative cap that covers the entire visible portion of the tooth, including the chewing surface, sides, and the front surface. Most crowns are made from either porcelain, ceramic, metal, or a combination of both. They are held in place on the tooth using adhesive cement. Placing a crown requires removing more tooth structure compared to veneers or bonding. Typically, around 2 millimeters or more of tooth structure must be removed to make room for the crown. After taking impressions of your teeth, the crown is fabricated in a lab and cemented onto your tooth. Similar to veneers, this procedure usually takes 2 or more visits. Dental crowns have a wide range of applications in dentistry, including restoring severely damaged, decayed, or weakened teeth. They can also be placed over a tooth following a root canal, or to serve as an anchor for a dental bridge. The average cost of a crown is between $800 to $3,500 per tooth. The price varies depending on factors such as the type of crown, the material used, and the complexity of the procedure. Crowns are the most invasive of the 3 procedures discussed in this video. However, they also offer the greatest amount of protection and coverage for the tooth. With proper oral hygiene and regular dental checkups, crowns can last for many years, even exceeding 25 years or more. Let's summarize veneers, bonding, and crowns. So, which one is right for you? If you're looking for a long-lasting and highly effective way to transform the appearance of your smile, and if you want to cover entire front teeth because of a large chip, a crack, or severe discoloration of your teeth, veneers may be a great option. Their stain-resistant properties ensure that your teeth will stay looking bright and beautiful over time. However, it is important to note that veneers are an irreversible procedure, meaning that once the enamel is removed, it cannot be replaced. So be sure to weigh the pros and cons carefully before making a decision. On the other hand, if you're looking for a more affordable and less invasive option, bonding may be a better choice. It is often used as a quick and easy solution for minor cosmetic issues like minor chips, cracks, or to make a short tooth look longer. Finally, if you need maximum protection for a tooth, or if the tooth is severely damaged, decayed, or weakened, a crown may be the best option. Despite being the most invasive of the 3 procedures, crowns are highly effective at restoring the strength and integrity of a tooth. With proper care, crowns can last for many years, providing you with a long-lasting solution for your oral health needs. I hope this video helped explain the differences between veneers, bonding, and crowns. Remember to consult with a dentist to determine which procedure is right for you based on your individual needs and circumstances. Thanks for watching, and see you in the next one.